Should you have caffeine right after surgery in order to expedite your recovery? Historically, patients were told not to have caffeine after surgery for fear of the effect of constricting the blood vessels and somehow impacting surgical recovery. For most surgeries, that has largely been disproven. Now, I will say that the discussion of whether or not you should have caffeine is definitely something that you need to have with your surgeon specific to your surgery, because there's definitely some situations where you want to avoid that increase in blood pressure and that constriction of blood vessels. But for many surgeries, caffeine after surgery can actually have really positive effects. Interestingly enough, there's randomized control trials to answer this question. Studies have shown that having caffeine after surgery can improve the return of your bowel function after surgery. There's many things during surgery that kind of just shuts down your GI system, things like anesthesia and pain medications, and especially any surgery where your intestines are actually touched. The intestines just kind of go into freeze mode after that and shut down for a while. Studies have shown that caffeine just expedites the recovery of your bowel function. That allows patients to have a bowel movement earlier, to tolerate solid food earlier, and because of all of that, actually have a shorter hospital stay just from having caffeine. Studies have also shown that having caffeine after surgery can allow you to awaken from anesthesia faster. So once you're already largely awake after anesthesia, but you're still kind of out of it a little bit, having caffeine can get you back to baseline faster. There's some other smaller studies showing that it might actually help with delirium after surgery as well. For me, the discussion with a lot of my patients is caffeine, if you're used to it, also just makes you feel normal after surgery. There's so many things after surgery that just make you feel unwell. You're in a hospital, you've just had surgery, you're in pain, you're having hospital food. And if you are used to that morning cup of caffeine, not having it can lead to a headache and just overall an unsatisfied patient. I allow my patients to have caffeine after surgery. If you are used to having caffeine after surgery, this is definitely something you want to discuss with your surgeon, not only because it's something you're used to and it's going to make you happy, but it actually might expedite your recovery.